And what about the lady approaching menopause and having issues with hot flushes and concerns about whether they go on hormone replacement therapy and the risks and benefits for that?
Unfortunately, there's still a huge anxiety in women about HRT, which I think is very unjustified. But there is certainly a group of patients, of women who suffer a lot and who cannot sleep, who have hot flushes and night sweats, vaginal dryness, feel very anxious, and beg me to help them. And I'm like, let's start some HRT. We know that the first 5 years of HRT, there is no increased risk of breast cancer because that's the main concern that they have. If women have had a hysterectomy and only need estrogen and no progesterone, even after 5 years, there is no increased risk.
Really?
There are other ways to reduce their risk, and usually we would try to limit the duration of treatment for less than 5 years if possible. But if they need it for longer, we would treat it for longer.